In this episode of Jugalbandi, meet Dr. Hussein and Dr. Farhad, a young couple who work together on a common passion, that is, dentistry. And over the years, they have learned how to demarcate their territories as doctors based on their individual strengths, also coming together beautifully when a project or rather a patient so demands. Has everything always flowed seamlessly, being spouses at home and partners at work? Let's find out. Relationships are tricky. Partnerships are always tricky, let's face it. But there are people who are making it work, not just in marriage, but also as a partnership at work. What are the challenges you face? What are the conflicts you have? How do you resolve it? Let me introduce Dr. Husain Harianwala and Dr. Farhath Sayed, who are both dentists of high repute and who have established the dental bond, which is 8 years old, and a marriage of 8 years old, but a relationship of 18 years old. So I'm very glad I'm meeting them at a juncture where the relationship is actually maturing into adulthood. Very warm welcome to Jugalbandi. Thanks for joining us.
Thank you very much, Afrida.
Can I begin by asking you, Farhad, how did you guys meet? How did the sparks fly?
We met when we were very young. We
Okay.
were just about 19. We met in college. He was my senior at university.
Okay.
It started off with a small, I can't use the word ragging, but yes, a little bit of an introduction session. But eventually we had similar likes, great passion for food.
Okay.
And he was also...
You met in Bombay?
No, we met in Karnataka. That is, it's in,
Where you were studying?
That's
school.
right, at dental school.
Okay.
And just then after that, we were together for many years. We did our masters in different places. We
But
went
I
on
asked you, when did the sparks fly? You have to tell me
Oh,
that.
the sparks flew, I think, about 2 years after we
After
met.
you met.
After
Okay.
a good friendship.
Okay.
And after understanding each other a little bit more than I think it should have happened.
What was
So,
the
yes.
moment for you,
Yeah.
Dr. Hussain? When you knew that she's the one?
I think as a 20-year-old, you're not, ever certain about these things.
Okay.
You just take it as it comes, and we were in a relationship for a very long time. I think during my masters, so we did our masters in different cities, and during my masters, when I was going through a very grueling time, the kind of peace that she would bring, over just simple phone communication. I think at that point in time, I felt that, this is very important and this is very good. And as an 18-year-old, my father, who's, quite a introvert, he shared with me one relationship advice.
Okay.
He said that choose a partner with whom you can communicate very well.
Okay.
Because all the physical and all of that is just a temporary phase. Your life is so much longer. At the end of the day, it's all about communication.
That's a very nice takeaway for those who
Right.
are getting into relationships and understanding relationships. I have a similar take. In fact, I say, I have a daughter who's 19. So I always say this, that find someone who's easy to be with. I think what your dad is saying is something similar, that easy to communicate, somebody who can bring some solace. But do you guys agree, Farhad, that a man and a woman coming together, the energies, the different strengths and, the different capabilities that we have, a man and a woman coming together at work, if you can really make it work in sync, it can bring beautiful results.
Absolutely. Absolutely. I think I'm complete advocate of a man and woman coming together because our thoughts are different, our strengths are different. Women usually are more controlled, and I would say they are looking at the small, finer details in different aspects, whereas the man, at least in our case, Hussein, has an eye for the bigger picture.
Okay,
He's able to
interesting.
foresee something that is coming after 5 years, 10 years, which I can probably never even imagine.
But one is micro, the other is more macro.
That's right. Absolutely.
And you are a micro specialist as well, right?
That's right. I'm a
Okay.
microscopic endodontist.
Microscopic endodontist.
So
yeah.
it makes me kind of, join the pieces of the puzzle which he has already painted, and I can never see that vision from the beginning. So it's beautiful, and that kind of camaraderie also has to be there because if I do not believe in his vision, I can never work towards it. If he does not believe in the steps that I'm taking forward, then he'll always think that it's never getting there. So but it's exciting to work with that kind of energy.
Do you feel, Dr. Hussain, that level of trust, the comfort, the ease makes it so much better at work?
Absolutely. I think But just to butt in before that, she said women are usually more they are controlled.
Yeah, restrained, no?
No, I completely disagree. I think
we are more gung-ho and excited.
Yeah, they're
sometimes you
completely
have to
out of
hold the reins.
control in my opinion, and
that's interesting.
I think the leash is on me.
Wow. Okay. No, I do understand both Farhad and you in different aspects, because sometimes we need somebody to hold us back. One person is a dreamer and wants to fly, the other is more grounded. And that also, I think, irrespective of gender, the man can be the dreamer, the woman can be the dreamer, it can happen. But now tell us about Dental Bond. Dr. Husain, how did you guys think of starting this together? Were there any uncertainties or doubts that if we work together and we are in that same space for that much at home and at work, was there any doubt, or it just was a spontaneous decision?
No, it wasn't a spontaneous decision at all, in fact. So we are so to say, not products of nepotism. So we don't come from a family of doctors. So for us, we were the first people in the medical profession to be in our own individual families. And when we were deciding our masters, so we were already seeing each other during our dentistry days. And when we were selecting our masters, I was quite clear on what I wanted to do. I wanted to do, prosthetics. It's a more wide arrayed field, which takes care of, broader perspective, yet in a very specialistic way. Root canals was the other major specialty which existed, and she was fortunately very inclined towards that. So I thought this would be a very good combination to begin with.
So you took a professional decision to work together, not so much an emotional one.
This was like around 8-9 years before we even got married. So it was, at that time, marriage was, only maybe in the mind, but, very far-fetched at that point in time. So that was where it began. And then I had a very long journey of dentistry, wherein I did my dentistry, I did my masters, I did my fellowship in the US, came back, and I was working for a few organizations, and that's when I realized that I'm a pure clinician from within. And when you're a pure clinician, you want to be making all the decisions for yourself. You don't want to be, you don't want a superior or a person above to be dictating things for us. So that's where I thought that, maybe having our own practice and running it in the most ethical possible way, that is where the real pleasure would lie. And that's why I was very clear that even though I had opportunities to stay back in the US, I did not want to work under people.
You needed that independence, and you were sure of it. Was it the same for you, a practical decision, or you also, of course, women are more emotional and we feel that, okay, I need that, support, or, somebody as a partner who's also a partner in life, and that will make work easy for me. Was it a more emotional driven decision or practical for you as well?
So I would say practical first and emotional later.
Okay.
I also had the opportunity to work with a large practice outside of India, where I understood that this is the way to go if I had to grow in future for myself. I mean, this was completely an independent decision from what Husain was doing.
So nobody had to
point
influence the other. No. You just came together naturally on this.
Organically, I wanted to have my own practice for similar reasons as what Husain said, and also to take it in a very in some sort of a leadership form, to make sure that the right kind of dentistry is being followed, whatever we think and we want to practice. And luckily, we both were in sync when it came to that thought. Of course, when we started together, there were differences because we came from different schools of clinical thought. But eventually, it just kind of boiled down to one little pot, which, made a lot of sense. And it took some time, but it made a lot of sense eventually, even from an administrator, from an execution standpoint, all of that. So
I was in fact coming to that there would have been some challenges that you face even working together, because the other couples that I talked to, different people have said different things. There was one couple who said, you know what, you tend to take your spouse for granted, which you would not have done if it was somebody else. So there are those things. Has that ever happened with you?
Absolutely. I mean, there are some things you just want, you kind of think that this is going to be her department. But as time has progressed, we have departmentalized a lot of things. So we try not to get in between each other's work, so that she's running her own parallel line of things and I'm running my own parallel line of things. So we're actually moving both in a forward direction. So that has been something we've been.
But yet you do come together. Like when I came to you guys, I found that both of you worked in tandem. Like for certain things I was asking you, for certain things I was asking you. So that also happens, I'm sure, when you're dealing
absolutely
with
clinically. our fields are such where what he does, and eventually I have to look after some aspect for the patient, and that
Okay.
is how our specialties are aligned. Luckily, he's into making sure he replaces teeth when they cannot be saved, and my job is to save teeth as much as we can. So it's completely in sync. Even if I had to do this independently, I would have needed a partner in his field, and I could not ask for a better partner,
Better,
even
yeah.
if he was not my partner in
In
life
life.
as well,
Okay,
because
that's
he is
nice.
a great implantologist. It makes it easy for me to pass on my patients when things are beyond my scope of dentistry. So it's a great clinical partnership that we have built up as well.
So, couple of last few questions, but now I'm going to go into
Yeah.
your relationship and marriage part of it. Do you carry work home? Do you have some, is it like talking shop at home as well, or you make a conscious decision, okay, now let's talk about our work? Dr.
I think
Hussain?
it's inevitable.
It is?
It does
Okay.
end up going home,
Yeah.
and because although we are working in the same office, we are usually together very little because we are usually in our own individual operatories. There are times in between, maybe we'll come and discuss cases. But once we're home, we're usually trying to spend maximum time with our son only. And
How difficult is it to switch then from the professional partner to the husband? Or is it seamless?
from the professional partner to the husband,
Yeah.
I think we've just grown to kind of accept who we are the way we are, and
You never have to apply your mind to
no, I
it.
don't have to ever
What
think
about you?
about it.
We don't have to
Don't have to
Yeah.
apply your
at
mind.
all.
Yeah.
And I think
Yeah.
our son makes it easy for
Easy.
us.
You have a 3-year-old.
Yes, we have a
Okay.
3-year-old. So
Yeah.
it's
So that switching of roles from being these hardcore professionals who are looking at cases, discussing stuff at work, you don't have any difficulty moving to the role of a wife and just being natural partners in life at home like everybody else is. There is no such moment that you have to think, okay, now I'm not his colleague, now I'm his wife. There is no such thing, is
no
it?
such thing, because it actually all started with love, right?
Yeah,
We
yeah,
started
yeah.
dating each other. We really
Yeah.
were in a lot of love
Yeah.
before we got into this
Into this,
professional
yeah.
Relationship. So there was that, and I think that is the core
So you
of
have
why
two
this
babies
is
actually.
successful.
You have this and,
Yes,
and your child.
absolutely.
Two
You
babies
nailed
together.
it. That's right.
I think lovely talking to you, Dr. Farhad and Dr. Husain. Thanks
Thank
so
you
much
so
for your
much.
time. One quick last thing, anything you want to tell couples like yourself? Doctors, I've seen a lot, when they get married, within the profession. Anything, any word of caution, Dr. Husain?
I think this trust is the most important thing, and I think everything is based out of trust. So
That's the crucial pillar, foundation of
Absolutely.
everything.
And I think friendship. First of all,
Okay.
never take it for granted that you're married or you're in a relationship. But the
Hmm.
friendship that is there to share everything small and big is, I guess, the foundation. I go back to Hussein for every small little thing. If I have something, tickling my brains, and it just eases
Yeah.
out.
I think we
So-
come back to the original point of how we ease each other out.
Yes.
I think that's a beautiful note to end this conversation. Thank you so much for watching Jugalbandi.